purpose of these chats is really to share best practice from other sectors, both outside pharma altogether and in sectors a little bit related, such as the consumer health arena, and really promote kind of marketing leadership, particularly around marketing leadership being an enabler of innovative business growth. So, we want to enable marketing leaders who are aspiring to grow their own careers to be able to push boundaries and make an impact. So with that in mind, no small setup for you there, Matt, make an impact. Over to you to just give us a brief intro to your background before we kick off with the first part of the conversation.
Okay, hi everyone. Thank you for inviting me to this fireside chat. I certainly feel very privileged, positioned to have been invited here and share my reflections and learnings and experiences you just described there. Just a bit of the boring bit up front. So what I will be sharing is my personal stories and experiences, as I just mentioned, and not those of my employer, GSK. You asked me about my background and my story. So maybe what I'll like to articulate is I cut my teeth in the old school way. I was started out as a sales representative, so I carried that black leather bag full of sales aids and promotional items, and I was driving between GP surgery to really find 5 minutes with doctors and nurses, and really that's where I learnt about the commercial world in pharma, and I spent a lot of time in my car thinking, how do I grow my sales, and it was a difficult place because you're on your own trying to manage your own business. Over time, I got to learn about marketing. I found that fascinating. I worked my way through various levels at UK marketing roles and then eventually into a global position. I've got over 2 decades of experience in pharma, in consumer healthcare, across Pfizer, across Danone, across GSK. And right. I've led HCP, patient consumer marketing campaigns, and ultimately what I was going to mention is what really always keeps me going and drives me is the same thing that got me getting out of the car when I was a sales rep, and that's about it's ultimately serving the patient. It's ultimately about improving patient outcomes and quality of life.
Great, thanks, Matt. So in the spirit of the sort of approach to these, what's interesting when I talk to people is getting their different perspectives around kind of what marketing leadership means, because it means different things to different people, obviously. And just want to kick off with saying very simply, what does real marketing leadership mean to you in today's world?
It's quite clear for me. Marketing leadership is about patient centricity. That's the word that I would put it. You often do hear people would say, well, it's about finding growth opportunities or spotting the space to grow into. So vision and decisiveness, I think that's quite important. But for me, I think you can't navigate that path unless you know who it is that you're serving, who it is that you're growing for. So understanding the insights, the pain points, really knowing about the emotions behind what is driving or preventing that consumer from doing something, I think is actually the foundation of marketing. And that's actually what should lead to you making decisions and strategic directions based off. So it helps guide your your plans, your innovations. So I think you need to get that bedrock right.
And basically what you're saying is understanding your customer inside out.
Absolutely. Yeah.
Yeah, interesting. I think, in today's world, particularly in pharma, obviously, there's a kind of focus, obviously, in prescription medicines around the healthcare professional, but equally never forgetting the patient, but fundamentally putting the customer at the center of your plans has huge ramifications across the business, both in terms of how you behave, but how you organize the business.
I think it's easy to, I think, lose
Yeah,
the customer, because we're in a fast-paced world.
yeah,
The stakes are high, the pressure's on. There's a million opportunities around you, and actually you need to, if you'll keep that customer at the center of everything, who we're serving, ultimately the patient, then that will actually help guide your decisions. I think that's that's the right way for me, that I think where you're making it the biggest impact.
Yeah, indeed. And I guess the obvious question sort of next is, well, not next, but following on from that is, what can you give us a sense of a situation or an example where, that relentless focus around the customer has helped inform a sort of game-changing initiative that either in, existing role or previous roles, that accepting that obviously you're not going to go into the detail of that, but illustrates that principle about customer insight?
Yeah, I can recall a time where I was leading the development of a global disease awareness campaign for consumers, to really get them to move along the funnel from awareness through to consideration and taking action. And the way to do that was really to understand where the blockers were, where the perceptions, what's preventing them moving through, and changing their behavior. So really, it's about understanding and listening. So a core component, of course, all marketers will know, it's about qual, it's about quant, it's gathering those insights, mapping that patient journey through the healthcare system, and digging down for the emotive reasons that is behind the data, that's behind the drivers and the blockers, right, that we'd normally call them. And when you do that, that actually drives the creative, that drives the decisions, that drives even the media plan, perhaps, that you put behind that global global campaign. So when it's grounded in the universal truth. So I'll give you an example. The campaign, uncovered people didn't see themselves at risk. They didn't talk about it. There's an element of shame about the disease. They didn't see that it was a severe or impactful disease.
Yeah.
So actually, we came up with a strategy to serve these patients with stories and experiences from patients who had experienced the disease that they could relate to and see themselves in. And we played that creative across media, where the consumer spends the majority of their time, our target audience. So it would be in TV or radio or out of home or in social media channels, just where they would perhaps expect to see stories and messages of that sort. So it's about really finding, I think, the route that talks about the human truth. It talks about what the consumer is already thinking and feeling, and your consumer is more likely to relate to it. And
so you're creating empathy, I guess, aren't you?
You're creating empathy. Exactly, you're creating empathy. They see themselves. They're like, wow, this campaign or this ad or this message is talking to me, the more likely to take notes.
It becomes more real, doesn't it? And I guess that leads to potentially, I might be jumping the gun here, but potentially more likely to lead to behaviour change, I guess.
Absolutely. I think you've hit the nail on the head there, because when that's the number one measure I would recommend the audience when you do campaigns like this, is look for behavior change, look for data that shows the consumers doing something different as a result, not clicking on or click-throughs or landing on your website, but actual behavior change that they have now started considering, or they have started moving towards the healthcare professional, something that indicates that they're doing something different and they're further along the funnel. Yeah,
indeed. And out of interest, in those sort of examples of that campaign, how do you sort of deal with the fact that you may not have as much insight around channel preference, like so many prescription medicine brands might understand that better from some of their CRM data? Did your research and focus groups draw any of that out as well?
It did. Some of it did. However, we you trial, you experiment, you try different things and test and learn and optimize along the way. I think is what I would answer that. Yes, we used our typical media buying agency that has the expertise about your target audience and the media channels that they're consuming along the journey, right? You would lean into that, but then of course try new channels, try new technology, try new spaces, and you'll find new stuff to adopt and bring in.
Yeah, indeed. Which kind of leads on, I suppose, to quite an interesting question, I suppose, given that example and your sort of focus on consumer healthcare. I guess what do you see? I mean, how, I suppose, is more the question. How do you sort of go about sort of creating that significant impact and behavior change through personalization when you don't have a CRM database like they might do in pharma? And it's a different challenge, isn't it?
I think
third-party data, I guess.
Interesting point. Yeah, I think typically in pharma you'd have a HCP structured CRM database that you can hit send and send emails and invite them to your webinars and what have you. And certainly typically in pharma you would not have a consumer or a patient database that you can lean into, so you can't tap up and ask these consumers their thoughts or get them to share their stories, for example. So for example, I mean, we had a common challenge where we were wanting to have a huge number of stories about that global campaign, about their disease, about their experience, across multiple countries. And as you can imagine, without that kind of CRM database, to recruit and find patients is time consuming. It's really costly, the slow process, and you need to find a better way. A way that we did it is I worked with our digital team and lent into Gen AI technology. And what we did is we trained the AI algorithm on data, on insights, on what people are saying on the internet, on quotes in social media campaigns. So you're feeding it a language and tone and words that consumers are using in the real world. And then that tool was then able to provide us with a library of authentic, diverse stories and quotes that would be embedded in real emotion and real language and real tone. And that helped us, circumnavigate that issue of not being able to contact lots of people in multiple countries. The AI algorithm was able to help us, to
and did that knit together kind of some of the sort of different data sources like Google Analytics and social listening and so on?
Social listening and media campaigns and your insight reports, absolutely, multiple sources.
Interesting. So that's what enabled you, I guess, to create the kind of, going back to what you were saying before about personas and different personalization of the plan.
Well, at the end of the day, it's about trying to find a way to bring about efficiencies. We're always trying to use the technology to bring about efficiencies, reduce budget, save time. But actually, I think a learning for me and for the audience as well is technology doesn't need to be about something cold and hard. It can actually help you connect with patients, and actually help you do stuff faster without losing the personal touch and the empathy that you described.
Right? That's interesting. That's really interesting. I must say, and forgive me, I might go slightly off piece here, but not dramatically, because there's a lot of talk about AI and technologies that allow us to, in theory, improve efficiency, obviously, but effectiveness as well, in theory. But actually, if I'm hearing you correctly, what I don't necessarily hear in pharma is lots of stories about effectiveness, whereas I do hear use of technology that's driving lots of efficiencies. Your example, and tell me if I'm putting words into your mouth, but your example is actually really illustrating effectiveness through the use of technology, because it's allowing you to take all of those third-party data sets and create a much more impactful approach to how you personalize an approach to your customer,
and ultimately give our countries then had multiple stories that were relevant culturally to them. And the AI tool enabled us to have that really diverse
interesting
library of options, so countries could make sure that it is really relevant for their customer in their country, in their market, in their situation.
In that classic debate of global versus local. Let's not get into that. It's really interesting. I guess also that presents a number of challenges, as we know, for pharma marketeers in general, in terms of the range of opportunities it presents to be innovative. But what would you say might be the highlights of those opportunities to really push the boundaries of how they can, to your words, remain focused on the customer, but at the same time as being innovative?
A good question. And let's face it, in the pharma world, we are a completely risk-averse beast, right? We're bound by the medical, legal, regulatory review process, and that's about protecting the companies. It's about protecting the customers and the patients. We are risk-averse by design. We gravitate towards what's worked before, the safe routes, right? But I think you articulated in your answer that the world around us is is changing rapidly, and technology is seemingly, and AI in particular is seeming to be like the next best thing, and how people consume information. So we as pharma companies need to evolve to that need. What my advice would be, you asked me what would I say, is actually it's the marketeers who don't wait for the permission. They don't wait for innovation or something, the opportunity to be turned up in their objectives, right?
Yeah.
That's the wrong way. What wrong way? You need to see, if you see an opportunity, make a business case, put together a proposal, send it up the chain, how it can bring about those efficiencies, as you were saying. And if you can save the company money, I'm sure they will respond and say, yes, let's go after this, this technology.
As long as it meets the customer need as well.
As long as it meets the strategy and the customer needs, you're absolutely right. But the advice is really just experiment, lean into it, and tie everything, I think exactly what you just said there, back to impact, and impact on the patient as well as the impact to the organization from an efficiency and cost perspective.
And just quickly dealing with that point and going back to what we talked about a little bit earlier, actually, what I think what you were saying is that the result of that example you gave led to real behavior change. Just illustrate for us, Matt, what type of behavior change and quantum you were seeing, if you can.
Well, the ultimate business change, behavior change that you always will be looking for from a consumer is speaking to their healthcare professional. It ends there. You need them to stop being reluctant, stop being hesitant to actually make that appointment, speak to the healthcare professional about the disease, about the condition, about whatever it is that you're trying to educate them on. So that's the ultimate measure at the end of the consumer journey, and that you want all of your decisions should be pointing how you're changing that behavior. Because if your campaign or your strategy or your opportunity is not actually going to make a difference in that end behavior change, then why bother? What are you doing? That's the one you should aim for.
Okay. And again, I'm just going to elevate this a little bit before we sort of think about those who are aspiring and how you might guide them. But sometimes marketing leaders in different organizations, because of the way particularly pharma companies are structured, historically and even now, in very siloed in different functions at different stages of the life cycle. Obviously, marketing has different importance in different organizations. I'm just interested, how you're quite right, in my opinion, view of that relentless focus on the customer, and doing everything around, how to meet that customer need and your business objectives. How do you, what's your opinion around who should own that customer? Because if we, I'll give you an example. If we step outside pharma or healthcare altogether into the consumer world, organizations reorganize their business around the customer. And obviously pharma's a long way from that, partly for regulatory and compliance reasons, and some would argue they hide behind those reasons for not doing that. But just interested in your perspective of the importance and in different companies on who owns the customer. Is it marketing? Is it the data team? Is it sales? Is it, because in the consumer health world, clearly it is marketing. But I'm just interested in your view, really.
An interesting philosophical question you've asked me there. I think it's a bit of a fuzzy space. You're right, because sales, medical, insights, marketing, we all touch the customer, right? But not everyone, I would say, sees the full picture. So actually, for me, that actually points back to and re-emphasizes it being marketing's role, because I think it's our responsibility to actually be the voice of the customer in those meetings, or when those strategic decisions need to be made. And that's not saying that we have to ignore our cross-functional team, because of course they're highly important, and they've got great. We don't do it alone. We do it collaboratively, right? And that helps bring the view of the customer together. But I think the owner, someone needs to be accountable for that, and I think that is 100% marketing, because we're uniquely positioned to be able to understand the full customer journey through the healthcare system, and all of the touch points, and what they're going through, and the insights. So it brings a really holistic view of the customer together. That would be my answer to it.
I might just ask you a brief provocative follow-up to that, which is which you by the way may or may not answer, but do you think that's a widely held view, or do you think you'd be sort of isolated in that view? In pharma, I suppose it's not fair to say what your view of prescription medicine pharma is, but perhaps in the consumer world, do you think that's a widely held view that people would agree with, that marketing owns the customer?
Definitely in the consumer space. That's because it's quite, I'd say, consumer or FMCG. It's much clearer that marketing owns the strategy as well. Marketing owns the plan and guides the organization. However, it seems less of a prominent front seat role in pharma. I see where you're getting at. But that's where actually the marketing team needs to position itself in, around the table, I would say, and make sure not only are they being the voice of the customers we've just described there, but actually to ensure that we're always talking about the impact to the patient, to the organization. And then you start talking about the language that the board wants to hear. They want to talk about growth and market share and business, right? So you need to be able to articulate the language of the business need as well, and that's marketing's responsibility. So we have a position at the table, and I think that's our job to try and lead those discussions.
Nice. Okay, well, I suppose that segues very nicely into a question, therefore, around aspiring marketeers in the industry. Do you have one or a couple of bits of advice for kind of those aspiring marketeers in leadership terms? What might be your views of that?
I think, well, I've got a couple. The first one is definitely, I think, highly aligned with what we were just talking about. Really know your customer deeply, not just the demographics and where they live, but really it's the emotions behind the data. Insights are what I would describe. It's not just a phase in the process, the journey. It's actually, I said this earlier, it's the foundation of the marketing. It really is what makes your marketing relevant and resonate, and what makes it human. So know your customer inside out, number one. The second one is perhaps a personal one for me, and that's actually around I would recommend, my advice to anyone who's starting out in business, not just pharma, is actually get to know yourself. Know your values, your strengths, your communication style, because actually that's what makes you you. Because actually, if you're able to lean into your wheelhouse, your strength, you're then actually able to make more powerful connections. You're able to build trusts, and you'll be able to work with people more effectively. So that is, it takes a long time. It does, to learn yourself, but actually, it's one of the biggest things that we need to do to become more effective within organizations.
Nice. Thank you. Well, I think we'll draw that to a close at that sage advice. So thank you very much, Matt, for joining us today. And we look forward to more of these PM talks as part of the Marketing Excellence Industry Group for the PM Society. But today, Matt, thanks very much for joining us.
No, thank you for the opportunity. It's been a great to be part of the conversation, and I hope some of the stories and reflections I've had resonate with some of the audience.